I'm Sue Romanoff, the head of healthcare content at Edison Group. Today, I have the distinct pleasure to speak with Marjan Mikel, CEO of Respiri. Welcome.
Hi, Sue. How are you?
Let's just kick it off here. Wheezo appears to take a comprehensive approach to asthma and COPD. Could you tell us a little bit about this and your SaaS platform?
Yeah, no, I'd love to. I mean, asthma and COPD are the two disease states, the third largest to afflict the human race. So there are almost 500 million people with combined disease states across the globe. In the US, that number is closer to 50 million patients. And the problem today is that when a patient leaves the care of their physician, hospital, or whoever the healthcare provider is, that physician or patient have absolutely no idea what's happening with that patient's management of their disease state from the real world. And it's the real world where all these problems occur when it comes to exacerbations and ultimately hospitalizations, which are a huge burden on the public purse or the private purse, depending on where you are. But importantly, also causes a number of issues for patients that are living with the condition. Wheezo and our SaaS platform provide for the very first time the ability for a patient and their caring physician and carers to understand exactly how well their condition is being managed with the asthma plan or the COPD plan that the physicians put into place by providing real information in real time from the real world to the physician and the patient and their carers, allowing those stakeholders to understand whether the condition's being managed properly, whether the condition's deteriorating, and if it is, what needs to happen to avoid complications happening. Now, this is the first time that a complete solution like this has been available in respiratory medicine. And it's also very important to note that in the United States, the Wheezo solution is reimbursed through the remote patient monitoring CPT codes. So doctors are uniquely positioned to provide this really needed solution, but also get remunerated for providing that service to their customers or patients.
Okay. Just to touch on that, it appears that though the asthma COPD control market has changed very little in the last decade, why do you think this is so? And how do you change old behaviors and compliance for better outcomes?
You know, it's not restricted to asthma and COPD. There have been great advancements in the medications that are available for controlling asthma and COPD over the years. Yet there's been very little movement when it comes to outcomes data relating to those two disease states, despite the improvements. We believe, and it's not just we believe, the published data would suggest that the part of the reason for that is there is a level of compliance and persistence with patients that's not satisfactory. And that part of that problem is that there is no way for the patient to get a real-time feedback loop as to what's happening with them when they actually take their medication. Because the reality is that 99% of the time there's no problem with patients, and it's that 1% that causes all the issue. It's important for us to be able to engage patients with their condition and the plans that have been put in place, and to be able to demonstrate to them a feedback loop that allows them to evaluate how well they're being managed, because often it's when the patient realizes there's a problem, it's too late. Now, Wheezo and the SaaS platform that we've developed provide a tool that allows patients to engage with their condition and share that information in real time with their physicians, and I guess approach the conditions management from a partnership perspective. Now, we know from work that we've done in Australia that our compliance rates and persistence rates with Wheezo and our programs in remote patient monitoring are in excess of 82%, which is world-class when it comes to actually engaging. And we know from the results of those particular studies that we have seen a reduction in the asthma control test, which is a clinically validated tool that doctors use for asthma in this particular instance, we improve the rating by 5.1 points. Now, what does that mean? It means that it is clinically significant improvement in how the patient actually feels and how well their condition's being managed. And we know that ACT improvements or deteriorations are proven lead indicators to hospitalizations. Now, those things come together quite nicely to help us provide an additional tool that allows patients to better understand how well they're being controlled, and importantly, have their doctors understand whether or not their condition's under control and to do something about it when they are not. So it's basically optimizing the treatments that are available there at the moment and allowing patients to better engage with whatever plan's been put in place. And the results from the studies that we've seen and done ourselves is a positive outcome.
Yeah, that sounds great. What's your go-to-market strategy?
We have very much pivoted to the United States. It is, apart from being the behemoth that the US is, 30 times, for instance, the size of the Australian marketplace, it also provides a market dynamic which is very attractive for Respiri, our devices, and the SaaS platform. It's the only market in the world where remote patient monitoring is actually reimbursed by payers. In this instance, CMS. So that's the Centers of Medicare and Medicaid Services, and the private health insurers do take their lead from them. Important to note, it's not us that get reimbursed for the service by providing the device, it's the doctors. It's the only marketplace in the world where the physicians are actually rewarded for providing world-class care in the form of remote patient monitoring. That's really important for us. Also important to note is that the doctors can actually outsource to a third party the entire patient management program in the areas of remote patient monitoring once they've commenced the patient on therapy. That's very unique in the US marketplace as well. Other stakeholders, such as hospitals, have a vested interest in making sure that they reduce readmission rates because they will get rewarded by payers by having those readmission rates reduced, which reduce costs to payers. So they have a vested interest in making sure that remote patient monitoring works as well. And the final stakeholder, of course, is the payer. You know, in the United States, for instance, they pay for all healthcare. They aren't selective in what it is they pay for and don't pay for. So anything that they can do to encourage moving healthcare from high-cost environments down to lower-cost environments, such as the home, they're very interested in. So fundamentally, all the stakeholders are aligned around remote patient monitoring in the United States. And that leads to a much better potential patient outcome, which is why we're doing all these things. A healthier patient results in lower healthcare costs. Now, in saying all that, we do not want to replicate an infrastructure in the United States that already exists. So our commercialization strategy in the US is very much a bespoke partnering model, where we are working with world-class providers of remote patient monitoring solutions that are sold into hospitals, doctors, and payers. At the moment, we have two, and we are very selective in who we choose because we want to maintain the premium nature of the wheeze device and the SaaS platform. They are Access Telehealth and also mTelehealth. These two partners of ours have established relationships with ACOs, hospitals, doctors, and payers, and are currently actively selling in the solution that wheezo provides in respiratory medicine, understanding that today nothing is available in that space in respiratory medicine, and nothing is easily available and covered by reimbursement in the United States when it comes to respiratory medicine. So it's a very attractive alternative for them as a partner. And importantly, it fills a need that major institutions currently have no solution for in respiratory medicine. So we partner with them. It is a very cost-effective way of doing business in the United States. it's important to note that we've been very, very successful with our launch. We essentially launched into the United States from a zero base at the beginning of 2022. And within 6 months, we've had traction. We've got customers who are using wheezo, and we've got a very, very rich pipeline. Now, for anyone who's worked in healthcare, to achieve all of that from zero ground level in 6 months is quite a remarkable achievement and testament to the business model and the team that we have.
Right, that makes sense. You touched on this a little bit. The U.S. reimbursement model is a very critical consideration. Could you explain your revenue model and how the physician, payer, and patients all benefit?
Sure. Our fundamental revenue streams are built around two lines. One is the sale of the device, wheezo, to our partners. That's Access Telehealth and mTelehealth upfront. For a price of between $50 and $60 per device. And we'll be making roughly a 30% margin on those devices moving forward. Now that's nice, but the major source of revenue for us is the recurring revenue that we charge our partners per patient per month for each patient that's put on the wheezo platform. So that's somewhere between $5 and $20, depending on the scope of work that is outsourced to our partners by the physician, hospital, or payer. So a simple data transfer with the use of the device is the lower end of that, but the higher end is also achievable when doctors and hospitals outsource the patient interaction to our customers. I'm sorry. So that's the fundamental building blocks of our business strategy. As I said previously, the US is the only place in the world where physicians are directly reimbursed for providing devices and remote patient monitoring solutions to their patients. So they are motivated to provide better care to their patients. And in the United States, payers and all stakeholders understand the value of preventative medicine and understand the importance of a successful remote patient monitoring solution in delivering that. Now, and as I said previously as well, the better that we can manage patients in the real world through a more transparent approach, the better the outcomes. The better the outcomes, the lower the readmission rates. The lower the readmission rates, the better the patient outcomes again, and the cheaper the healthcare provision bills are to payers, hospitals, and physicians. So it's a win-win situation that's basically providing a solution from the real world in real time that I guess gets a bigger bang for dollar spent on healthcare provision. So everyone's a winner, particularly in the United States.
Great. So finally, what events or catalysts should investors look out for in the next 12 months?
Look, we've got an exciting next 12 months coming up. Despite everything that we've achieved in a very short period of time, there's a lot more happening. As a major event, Respiri and its device wheezo will in October this year be the first Australian manufactured device that will be used by physicians to claim remote patient monitoring CPT reimbursement claims. So no other Australian company has done this. We will be the first. And that's a beachhead moment for the organization because it fundamentally underpins the business model that I described previously. So that's happening in October, and we're very excited about that because that will then continue to grow our revenue stream and patient numbers as we move forward. The other obvious areas that we are very excited about is we've already secured 2 customers in the United States, one being Michigan University Hospital, in particular the pediatrics pulmonary ward. And they are using wheezo and the solution through our partners Access Telehealth to provide asthma management solutions, remote patient management solutions to children, which is really important and where asthma is a significant problem. The other customer is a customer in North Carolina, and they'll be playing at the other end of our spectrum, and that's with chronic obstructive pulmonary disease or COPD patients who are typically older. And they will be utilizing the wheezo solution to help better manage those patients who are a huge cost burden to payers and society. So that's happening as we speak now, and that's being rolled out. We're also in the process of finalizing, in the immediate term, 6 other contracts with major healthcare institutions, hospitals and ACOs included, and they will start rolling out over the next month or two. So we're very excited about broadening our presence across the United States and with more customers. We also have in excess of 120 qualified leads, and they are at various levels of business development cycle, and they will all be coming on board over the next period of time. And each customer is a significant source of patients and a significant opportunity for wheezo and our solutions to demonstrate the benefits that remote patient monitoring can offer to these patients. So there is a very rich pipeline of wonderful events that we will be experiencing, announcing over the next 12 months. And nothing groundbreaking in the context of innovation necessarily. That's a discussion for a later pace with our R&D platform, but certainly very important when it comes to establishing wheezo as part of the standard of care in patients with respiratory disorders. And the more doctors, hospitals, ACOs, and payers that come on board and endorse the use of wheezo in RPM, the better that will be achieved.
Great, Marjan. Thank you for taking the time. Thank you for taking the time for everyone else here also for joining us. Have a good day, everyone.
My pleasure. Thank you very much, Sue. My pleasure.